Welcome to our presentation about an article called The Role of Anxiety in Young Children's Pain Memory Development. First, we'll give you a bit of an introduction and a background, and we'll talk about the hypotheses of the article. We'll also talk about the measures and methodology, the results and the discussion of the article, and we'll identify some gaps in the research, and we'll do a proposal for a new study. Like I said, the article talks about anxiety, and anxiety is defined as an emotion characterized by feelings of tension, worried thoughts, usually future-oriented, and physical changes like increased blood pressure or sweating. And memory is defined as the faculty of encoding, storing, and retrieving information. And to explain memory a little bit further, I'll use this memory model where sensory input is stored into short-term memory. And then if it's rehearsed enough, it will be encoded into long-term memory. And the process of remembering events from your long-term memory is called retrieval. Some important notes to make about memory is that emotion enhances memory, and memory can be biased. It can be negatively biased, meaning the memory can be exaggerated, or it can be positively biased, and then the memory is not exaggerated. You have two types of memory. Semantic memory is remembering facts, and episodic memory is mostly remembering events. And that's what this article talks about. Pain memory predicts pain intensity. And if this pain memory is negatively biased, this can be linked to pain after a surgery. The negative biased pain memory is also linked to future pain intensity and fear around the surgery. For children, it's more likely to have distorted memory, or more negative or more positive biased pain memories. And it's really important to research this question because this way you can prevent children from developing negative biased pain memories and also then future pain. Especially if children are anxious, they can have more negative biased pain memories, and preoperative anxiety can also increase future pain intensity and fear around a surgery. And future pain intensity and fear in itself can also influence the negative biased pain memory, making it kind of a downward circle. And one more important factor for young children are their parents. And especially if parents are anxious, they can increase the negative biased pain memories of children. And the reason for this is that parents who are anxious can use a lot of language. For example, oh, I can see you're scared, or this must be scary for you, which kind of put the attention of the child towards the negative experience. But there's also a mechanism called observational learning, where children see their parents actually being anxious or anxiously talking to a doctor, and they will kind of incorporate that and see, they kind of see their parents being anxious. And this is illustrated in this video where a child imitates her mother in pain, and a father with a walking stick. So the first hypothesis is that anxious parents will, if your parent is anxious, you're more likely as a child to have negative biased pain memory. And preoperative anxiety in the children will also increase the negative biased pain memories. And the last hypothesis is that negative biased pain memories increase indeed future pain intensity and fear.
Okay, before I get into the methods, let me elaborate on some of the tools that we used to measure pain and pain-related fear. Okay, so the study measured the parent's state and trait anxiety using the state trait anxiety inventory, which they use that to find correlations with the child's pain memory development. So the state anxiety is situation specific, whereas trait anxiety is more to do with personality and is more innate compared to state anxiety. Okay. In order to account for individual differences, researchers also measured how anxious the children were before they went to surgery, and they used a modified Yale preoperative anxiety scale, also MyPath for short, to measure this, and it assessed the preoperative anxiety in terms of these 4 aspects, as you can see on the screen. Okay. Another thing is that measuring pain and pain-related fear in young children is difficult, which means that you have to have the appropriate scales and tools that make the results valid and reliable. So they use the children's fear scale, CFS for short, and faces pain scale, also FPS for short, to do that. Okay, so now let's go into the methodology. 1 to 3 weeks before the study, interested parents filled out an online consent form and questionnaires. And this includes the social demographic questionnaire and the trait anxiety inventory questionnaire. And then on the day of surgery, the parents filled out the trait anxiety inventory, and researcher assistants coded in the MyPass while the children were falling asleep during their surgery. As they were doing that, the parents received hard copies of the children's fear scale and the faces pain scale and instructions on how to use them. Okay, then we move on to 1, 2, and 3 days after the surgery, where parents administer these scales and use them to measure the child's pain and pain-related fear each day. So days 1, 2, and 3. Then 1 month after, research assistant conducted a telephonic interview, which tested the child's memory in regards to these 2 things, so pain intensity and pain-related fear.
So results of this study have shown some interesting insights about the interactions between the key variables. So there's 6 main variables that interact with each other throughout this experiment to achieve the results that we got. So the experimenters measured both self-reported pain and pain-related fear, as well as the memory of pain and pain-related fear. And they also measured this on the day of the surgery and the 3 days after the surgery. So we can see the results in the table here. There were correlations found, the child's preoperative anxiety was also measured, as well as the parents' state and trait anxieties. And the correlations between these are shown in this table here. So there was a positive correlation found between the post-surgical pain on day 1 and the recall of pain on day 1. So this means that if you felt pain on the day of the surgery, you remembered a lot more pain. We also see a positive correlation between the post-surgical pain intensity on the days after surgery and a recall of pain intensity and pain-related fear on the days after surgery. And these are shown by all the circles, all the red circles on the table. Now, there are also hierarchical regression models, which are models that show the relationship between 2 variables after accounting for the other variables and controlling them. So we can see this in these 4 models here. And what the 4th model, which is the most important one, tells us is that children who developed negatively biased pain memories tend to have worse post-surgical pain several days after the surgery, but not on the first day after surgery.
Moving on to discussion, parent but not child anxiety predicted the degree to which children developed negatively biased pain memories. At the 1 month time point, there is negative biases in children's pain memory found when the adult anxiety occurs before surgery. Younger children, years 2 to 3, were more likely to be subject to this bias than older children in the population 4 to 10 years old. Children aged 2 to 3 showed a lot more pre-operative anxiety and stress in comparison to the 4 to 10 year age groups. This is likely because they get older, they have much better understanding of what's going on in the operation. Limitations included the pain management strategies in the first few days following surgery. It is mentioned that medication is typically only used in the first day following surgery, and that it might have an impact on pain memory. At the 1 month, there is no correlation between children's preoperative anxiety and negative biases. Repeatedly emphasizing the pain threat value can cause abnormal pain memory biases. This is evident in highly anxious parents who may repeatedly reinforce the fears of pain and pass it on to their children. Now I'll pass it on to Katie.
Moving on from the discussion to the gaps in the research, this is critical because after finding a very influential piece of evidence saying that adult pain has an influence in, or adult anxiety has an influence in their child's pain post-surgery, it's crucial to see that that study only goes to the month following the tonsillectomy. In further research and literature, it's found that pain memory can cause pain-related fear, and that this pain-related fear can cause shifts in medical behavior. This could be detrimental because medical behavior can influence things like postponing medical appointments or interventions, or even receiving vaccination. Since there is no research that currently looks at long-term pain-related fear, that's what we are going to propose, is a study that would see those aspects.
Based on the gap identified in the study, we propose that a more longer-term pain memory study be conducted with follow-up with the patient once they have turned 18 years old. The methods that we use is a questionnaire that can be issued to the patient once they turn 18 plus, and in charge of their own medical needs, which would include the following topics. The first one being memory of the tonsillectomy procedure using the same fear scale. The second one would be past surgical and medical procedures since the tonsillectomy and possible problematic negative experiences. In this case, our study will have two subsets of individuals. By listing other medical surgeries using a scale from 1 being little to no pain and 5 being extremely painful. One group would have experienced medical procedures with no negative experiences, and the second group will have include participants who have had experienced negative medical procedures. The implication of this would account for differences in the medical behavior where participants who have undergone far worse procedures may have different biases. And the third one is current medical behavior. How often are you postponing doctor's visits? Do you have any vaccinations that you have avoided currently? And that will conclude our presentation. Thank you.